Today's conversation centers on one of the most urgent and most unifying issues that we face, the mental health and well-being of our nation's young people.
There's a lot of work to do to hold, I think, society accountable for the way that we use social media. There's a lot of work that we need to do to remove the stigma.
We think about the continuum of care that we provide, but we can't just start at treatment. We have to start at prevention.
I like this report because it basically says two things. Let's look at what's working and keep it going, and let's get rid of that doesn't work.
The kids are our future, and we've got to pay attention to bringing those children up in a way that they're going to be productive members of society.
A lot of the resources that are available for families and parents don't necessarily fit every single family structure.
I think what we need is awareness and kind of destigmatizing mental health care so that people don't think that it's their fault if they're feeling a certain way.
One of my favorite sayings is like the opposite of addiction is connection. I've been there, I've done that, I understand where you're at, and I know that there's a way out.
I think another barrier that we don't talk enough about is the need to have insurers cover early help, including before there's actually a diagnosis for a child.
We need a health system that is really proactive rather than reactive, right? Rather than waiting until the problems start to appear, detecting them early on and addressing them.
When you go to the pediatrician, right, they ask, okay, is your child wearing a bike helmet when they ride their bike? Is the car seat facing the right way, right? These are things they ask everybody, and it's not stigmatized. We could do the exact same thing with mental health.
One thing is clear. There's still strong bipartisan momentum at both the federal and state levels to address the youth mental health and substance use crisis.